When does yoga start to work? This is a very big question. Here in our own yoga therapy practice, we find that some patients respond to the yoga practices on the same day, while others may take a week, 2, 3, or even up to 4 weeks to start to respond to the yoga practices that have been designed for their specific condition. We have found that some of the parameters like your heart rate and blood pressure, even in one session of an integrative yoga practice, you can start to see changes in most of the patients. We have also seen the immediate effect of different techniques. We have seen that 5 minutes of doing certain pranayamas, such as the Sukha pranayama, just breathing in and out for the same count, or the left nostril breathing in and out through the uni nostril, the left uni nostril, that is the Chandra Nadi pranayama. We have found 5 minutes of doing the Pranava pranayama with the A, U, sounds, both in sitting and lying down. They have an immediate effect. But one of the major questions that comes is when we are doing the different asanas. Because most of the yoga asanas seem to induce a bit of sympathetic arousal. And so when you do the asana, your heart rate and blood pressure and other parameters may start to go up on a transient basis during the actual technique. And we found when you do Dhanurasana, the bow posture, it does go up. But then when you stop doing the posture and you give yourself a bit of relaxation, within 2 minutes, you start to go to a value, your heart rate and blood pressure, that is lower than where you were in the first place. So it seems that when you make an effort in an yoga asana, there seems to be a transient sympathetic arousal, but this then, when you stop doing the practice and if you relax, the key word is to relax in between, the parameter can come down and it ends up lower than where you are. So the overall effect of the yoga practice seems to be of parasympathetic dominance of balance of the autonomic function. But the initial sympathetic arousal is there. And this is why when we are practicing the yoga techniques, especially asanas where we have to make a lot of effort, some of those practices which are quite strenuous, it is very important that after the practice to have an adequate period of relaxation. At Saita, we have evaluated what happens to heart rate and blood pressure in different asanas, and we have again found the same thing, that initially there may be a rise in the parameter when you are doing the asana or immediately after. But then if you can just wait and give yourself that much needed relaxation, you are going to see the real benefit of yoga coming in. And this is why every yoga session, be it an individual practice or an integrative practice of different techniques, it is vital that you have a relaxation at the end. 10 minutes of Shavasana at the end of 50 minutes of effort is where the benefits of that 50 minutes start to seep into your cells. And then when you come out of that relaxation, you have got all the benefits of the techniques you have done. But most people skip the relaxation. And they think, I have done 50 minutes and I am running late, let me run out. And they end up on that upswing, not giving enough time for the downswing to occur. And this is why it is very vital that when you do your yoga practice, make sure you have that 10 minutes of relaxation. If you have 1 hour, take 10 to 15 minutes. If you have 45 minutes, take 10 minutes. And if you do half an hour, please take at least 7 or 8 minutes of relaxation to make sure that you are ending up on a balanced, healthier, much more composed state of being rather than an uptight, agitated, sympathetic state of being. That is the antithesis of what yoga stands for. Yoga is all about balance, and balance can only occur when the spanda, the effort, the contraction is coupled with nishpanda, the relaxation, the deactivation, and the spanda nishpanda results in balance.